Let's discuss about electrolytes panel, which includes sodium, potassium, chloride. What is electrolytes? An electrolyte test is a blood test that measures if there is an electrolyte imbalance in the body. Electrolytes are salt and minerals such as sodium, potassium, chloride, which are found in the blood. They can conduct electrical impulses in the body. An electrolyte panel, also known as a serum electrolyte test, is a blood test that measures the level of the body's main electrolytes, sodium, potassium, and chloride. Let's discuss one by one. Sodium, which helps control the amount of fluid in the body. It also helps your nerves and muscles work properly. Chloride, which also helps control the amount of fluid in the body. In addition, it helps maintain healthy blood volume and blood pressure. Potassium, which helps your heart and muscles work properly. Why electrolyte panel is done? This test is sometimes carried out during a routine physical examination, or it may be used as a part of a more comprehensive set of tests. For example, your electrolyte level may be checked if you are prescribed certain medications such as diuretics, converting enzyme inhibitors, which are often used to treat high blood pressure, as well as checking level of electrolytes in the blood. An electrolyte panel, a group of specific blood tests, can also be used to find out if there is an acid-base imbalance. A normal arterial blood pH range is 7.35 to 7.45. An electrolyte test can also be used to monitor the effectiveness of treatment for an imbalance that affects how well your organs work. Let's discuss the common symptoms of an electrolyte disorder include irregular heartbeat, fast heart rate, fatigue, convulsion, nausea, vomiting, muscle cramping, muscle weakness, irritability, confusion, headaches, numbness and tingling, diarrhea or constipation, abdominal cramping. Remember, call your doctor right away if you are experiencing any of these symptoms and suspect you might have an electrolyte disorder. Electrolyte disturbance can become life-threatening if left untreated. What does the electrolyte result mean? Your specific result will depend on which electrolyte is affected and whether levels are too low or too high. If your electrolyte levels were not in the normal range, it doesn't necessarily mean you have a medical problem needing treatment. Many factors can affect electrolyte level. Here we go. These include taking too much fluid or losing fluid because of vomiting or diarrhea. Also, certain medicines such as antacids and blood pressure medicines may cause abnormal result. What are the normal ranges for electrolytes? Your age, sex, and pre-existing health condition can affect test result. And laboratories often use different methods for measuring electrolytes. This means result can vary from lab to lab. Labs measure electrolyte by looking at concentration of the substance in a specific amount of blood. In general, these are the normal ranges for electrolytes. For sodium, 136 to 144 mmol/L. For potassium, 3.7 to 5.1 mmol/L. For chloride, 97 to 105 mmol/L. Let's discuss how to maintain or reduce electrolyte. Here are some best practices to help ensure a healthy electrolyte balance. Drink plenty of water. Avoid beverages that are diuretics like caffeine and alcohol that draw water from your body. Eat foods that contain electrolyte. Do not eliminate salt from your diet. When selecting a beverage other than water, look to those with a moderate amount of sodium and potassium. Monitor your urine, especially before working out. Consume an electrolyte beverage, especially if you do intense physical work or work under high heat condition. Thank you for watching the video.